Childhood trauma can have a lasting impact on a person's life, affecting their physical, emotional, and mental well-being long into adulthood. Trauma is defined as any event or experience that causes significant emotional distress or harm, and it can take many forms, including physical or sexual abuse, neglect, and exposure to violence or trauma at home or within the local community. The effects of childhood trauma can be wide-ranging and can manifest in many different ways. Some of the most common effects include anxiety and depression. Trauma can disrupt the normal functioning of the brain, leading to anxiety and depression. These conditions can be debilitating and can make it difficult for a person to manage daily tasks and responsibilities. Next is PTSD. PTSD is a serious condition that can develop after a person experiences or witnesses a traumatic event. Symptoms of PTSD include flashbacks, nightmares, and feelings of guilt, shame, and anger. Many people who have experienced childhood trauma turn to drugs or alcohol as a way to cope with emotional pain. Substance abuse can lead to addiction and further health problems. Childhood trauma can also have a negative impact on physical health. Research has linked childhood trauma to a high risk of chronic diseases such as heart disease, diabetes, and cancer. Trauma can also affect a person's ability to trust others and form healthy relationships. They may struggle with intimacy and may find it difficult to trust or rely on others. Childhood trauma can also affect a person's ability to succeed academically or in their career, as they may struggle with concentration and motivation, and may have difficulty managing stress. The good news is that there are ways to heal from childhood trauma. Treatment options include talking to a trained therapist can help a person process their traumatic experiences and learn coping skills. Different types of therapy, such as cognitive behavioral therapy, also known as CBT, eye movement desensitization and reprocessing, also known as EMDR, and trauma-focused cognitive behavioral therapy, also known as TFCBT, have been shown to be effective in treating childhood trauma. Medications, such as antidepressants and anti-anxiety medication, can be used to manage symptoms of depression, anxiety, and PTSD. Joining a support group can provide a sense of community and validation. It can also be an opportunity to learn from others who have been through similar experiences. Trauma can take a toll on a person's physical and emotional well-being, so it's important to prioritize self-care. This can include things like regular exercise, good sleep hygiene, and healthy eating. It's important to note that healing from childhood trauma is not a linear process, and it may take time, patience, and support. Some people may find that they need to try different approaches to find what works best for them. Lastly, and most importantly, remember that healing is possible and that you are not alone. That concludes this video. Check the description below for other videos you may find helpful. Thank you for watching. Subscribe to the channel and smash the like button below to show your support. Until next time.